Hey guys, welcome to Preacher Girl. Today I get to interview Victory Dyer. We got BSN-RN, CCRN, CFRN?
Yeah.
So many initials. So
a lot of letters.
Welcome. Tell us about you. Tell us what you're up to.
So, you covered it. I'm a flight nurse right now. I've been a flight nurse for 4 years. I worked in the CVICU prior to that. And this week I started my DNP program to become a nurse anesthetist. So, yep.
That's so exciting. So you started in an ICU as a new grad?
I did. I started in the CVICU as a new grad. Actually, you worked with me when I was just a little baby.
Little baby. You were so impressive. Your personality, the way you address people, and then you were just an exceptional ICU nurse. And so I was not surprised one bit when you went to flight nursing. But tell us how that transition happened. How did you go from ICU into flight nursing?
Okay, well, first of all, you were like an incredible mentor for me. And it's funny, I was like going through my stuff the other day and I have your little hemodynamic cheat sheet, like still to this day I had it. And I was like, oh, Ash. But anyways, I always knew that I wanted to be a flight nurse, which is why I went into the ICU right away. I did my 3 years. I also did a year of ER just to kind of get that experience and be able to diversify my background a little bit. Yeah. And then I went through the application process and I was hired. That's like really skimming the surface. There's a lot more that goes into it. You need to have a bunch of certifications, obviously your ACLS PALS, some trauma certifications, and then a lot of studying and stuff for the interviews. The interview itself is a lot different than any other nursing interview that we're used to. It's completely scenario based. Oh. It's a lot like a national registry type of interview for the medics. So they give you, a couple patients and you basically tell them how you would treat that patient and what you're going to do in certain situations. So did that, then was onboarded with the company that I work for. Our academy is about three to 4 months, which was incredible. I learned so much, and then started flying. So I loved it, and I would do it all over again 100 times. So
wonderful. What's your favorite part about flying?
There's a couple things. So I love that no two patient is like the same. You go to work and you've no idea what you're gonna get. You could have a newborn, you could have, your septic ICU patient, or you could have, a pregnancy or a scene call off the freeway. Like every day is something different, which is so cool. It keeps you fresh. It keeps you really have to hone in on your skills and stay up on your education. And then the people, it attracts a certain type of person into this field. So, you all become like a family, and the people that I worked with or still work with are just some of the most incredible people. So I would say the people and the variation of patients.
Awesome. What's your schedule like as a flight nurse?
So they just changed it up a little bit, but it's 24-hour shifts. And the way it kind of equates to is about 10 shifts a month. So there's different schedules, but if you think of a firefighter schedule where there's this, rotation where you do like 3 on and off 24-hour shifts, and then you get 4 days off or so, that's typically what it looks like.
Nice. And do you like that? Or how do the 24-hour shifts go?
Yeah, so it really just depends on your shift. If you fly all day and then you fly all night, you're exhausted, and then you're like, make this stop and like immediately. But most of the time you do get some downtime in there, so I do really like it, and then I enjoy my days off. My husband's a firefighter, so his schedule is pretty much the same as mine, so we'll get chunks of time off together, which is nice.
That is so nice.
So I like the schedule, but I can see how it's not for everyone.
Sure, absolutely. Do you miss being in an ICU setting?
No.
Do you miss being in an ER setting?
Absolutely not. No.
What kind of pushed you? Did you just always want to be a flight nurse, or were you kind of burnt out on the hospital side of things?
You know what, I will say towards the end of my 3 years in the ICU, I was pretty burnt out. I was coming home every day, like pretty miserable. But I had that end goal in sight. So I would say it was okay. I knew that I wasn't going to be there forever. But it was tough towards the end. As far as I always knew I wanted to be a flight nurse. I love that, you know, you have such a huge autonomy and your level of education is unlike anywhere else. You know, we're constantly training. You know, I don't have to ask for orders. I don't have to, I get to basically like diagnose and treat, not diagnose, but differential diagnose and treat patients based on my knowledge base with my partner, which is not something I could do as a nurse really anywhere else. As well as my scope of practice is huge compared to a hospital or bedside nurse. And that was really important for me too, something that I really wanted. So, yeah.
That's incredible. Let's go back a little bit. How did you even know you wanted to be a nurse?
So you know, and I don't know exactly when I was like, I want to be a nurse. My mom says when I was like a little girl, I said I wanted to be a nurse. But I had always loved like caring for people, caring for animals. You know, I never shied from, you know, blood and gore. I always just knew I wanted to be in the helping field. And then going throughout school, I had this passion for science. I really love science. Math, I hated, but science, I was like, this is so cool. It was really interesting to me. And then when we got into the more of like the physiologic science stuff, I was like, oh, this is amazing. So all of that together really kind of solidified for me that nursing was the path that I should take.
What was your why for getting in? Like now that you're a nurse looking back, is it to care for people, or are you just an adrenaline junkie, or do you just want to like be in control?
Both. I kind of say it's like that human factor of caring for people mixed with that critical care, like that love of critical care and science and medicine. And then the helicopter, of course, you know, it's so exciting and it's fun. I think that if you're having fun at work, like you're doing something right. So
yes. That is so imperative. And I remember back when we worked together, we worked at a very intense ICU and it kind of never shut off. But I remember we just had fun. And it wasn't goof off fun, it was serious fun. But when you have a good team of people and you have that autonomy and you are able to actually make interventions that can benefit someone's life in the moment, it's an incredible feeling. And having that team that you can kind of laugh off the stress with and the trauma is so important. And the pictures you post, everyone needs to follow your Instagram. The pictures you post from the sky are insane. I thought I had seen every beautiful sunset in Tucson, and you managed to capture some amazing scenes, girls. So we're going to add that link.
Sunset flights. Yeah, sunset and sunrise flights are like the best.
Killing it, girl. I love it.
You'd be surprised. So I've flown like in Mississippi and other parts of the state, and Arizona really is like the best for the views. You wouldn't think it, but we've got like some incredible terrain and the sunsets. It's really cool.
That is so cool. What's your longest flight been? Like from where to where and how long?
The longest flight was, probably like an hour and 15, an hour and 20. I mean, anything past that, you need to stop for fuel. And
okay.
You know, that's not ideal, especially with a patient on board.
Sure.
But those are like, that was height of COVID and, you know, bed placements were crazy. We actually flew into New Mexico for a bed. It was crazy. So.
Cool. Have you ever done CPR in the sky?
Yeah. Like 2 weeks ago, actually.
That's so cool.
It's not ideal, but
for any of those that haven't worked with Vic out there, she's the kind of nurse that is on top of the bed, sitting on the patient, doing compressions, going down the hallway. Like that is her. So picturing her in a helicopter doing CPR is just like a movie. I could totally see you doing that.
Yeah, it's not ideal. It's definitely not ideal, but
sure.
You gotta do what you gotta do.
Such an adrenaline junkie. So going back to being a new grad, thinking back to those early days, what kind of advice would you give yourself?
Oh my gosh. I think the same advice that I like kind of give our preceptees, the people that like come through now, is just to be kind to yourself. I was so hard on myself. You know, going into the CVICU, going into like any critical care as a new grad or from a different unit or whatever, it's like drinking from a fire hose. You are just like bombarded with information and you try and learn it all. And if you don't get something, at least for me, if I didn't get something, I was like, oh my gosh, you're so stupid. Like, why don't you understand this? Or like, oh, you messed that up. But like, just be nice to yourself because like, it's okay. It's okay. Everybody learns at their own pace and you'll get it. One day it'll just click. And then a month later, you won't like know anything all over again. And then it'll click again. Like, it's just definitely huge learning curve, but just be nice to yourself. Be kind.
Yeah, I can say even 10 years in, there is still stuff that I learn or relearn or better understand. Like sometimes an equation or an algorithm just clicks and it's like, oh
yeah.
How come I didn't put that, you know, chemical release with this transition, you know, those kind of things together, and it clicks and you're like, okay, still learning.
Yeah, always learning. I tell our new hires and stuff, like the day you stop learning, like is the day you need to reevaluate what you're doing and maybe, you know, just look internally, like maybe we need to do something else because, you know, from every single flight, you should take something away. Every single patient, you should take something away. So super important. Keep learning.
That's really powerful. Well, what's next for you? You mentioned DNP program. Tell us more.
Yeah, so I just started my Nurse Anesthesis DNP program.
Congratulations.
Yeah. Thank you. So through the U of A, University of Arizona, I will be done in 3 years. So the next 3 years of my life are going to look a little bit different. I'm staying part-time with flight. So that's 4 24-hour shifts a month. And I'm going to do that until basically I have to do clinicals where it just won't be possible anymore. So I have about like 1.5 years still flying. Thank God, because I do seriously still love flying. But once I'm done with my nurse anesthesis program, hopefully gonna pass and become a CRNA, the boards afterwards, of course. And then specifically, you know, I would love to be a CRNA on a helicopter, and they do have some options for that, usually military, but some contract and reservist work. So I don't know, stay tuned.
That's insane.
Sure I'll be able to sleep. I just don't know where.
Maybe in the sky, maybe on the ground, not sure.
Yeah.
I had no idea they use a nurse anesthetist in the sky. Is that for transport or?
It's not necessarily like while you're flying. It's more of like mobile ORs. Yeah, like.
Wow, you are so incredible. And how did you find out about that?
So, you know, just through flying, a lot of the people we fly with are either prior military or still reservists. And so they work with a lot of the people that have connections to those groups. And they were told me, you know, tell me about it. And the people I work with, they knew that I wanted to go to CRNA school. And they're like, you should be a nurse anesthetist for the military, or you should be a nurse anesthetist contractor or whatever. So that's how I found out about it. There's still, like, I don't know much about it at all. I just know that it is an option. So definitely something I'm going to look into.
That is so cool. Now, let's jump back a little bit. Before getting into flight nursing, did you shadow or anything? Or is there any way for anyone out there to, like, get into a helicopter and see if it's right for them?
Yeah. So, I mean, things have changed a little bit with COVID, but I did do a ride along is what we call it. So it's like a shadow experience. You spend the day at the base with the crew and, you know, you get a flight, you get to go. I think I got 1 or 2 flights, which was incredible because you're not guaranteed that, you know?
Sure.
And I knew I wanted to be a flight nurse, but I wasn't sure if I was going to like get motion sickness or something. So that was the big thing for me. And I went on and I was like, oh, this is great. Not sick. Wonderful. Love it. I can do this. But yeah, so for people that are thinking that this is the career path that they want to take, definitely reach out to their local flight program. You know, they're all over, at least Arizona, they're all over like every state. And just ask, you know, what opportunities that they have for ride-alongs. We stopped doing them in COVID just because of exposure and everything.
Sure.
But I think that a lot of companies, and mine included, are opening back up to the ride-along possibilities.
Wonderful. Well, maybe I might do that. I always wanted to be a flight nurse too. Like even before I got into nursing school, I was like, I'm going to be a flight nurse. I don't even know how I knew that was a thing. But I've always been motion sick, and I've never been in a helicopter to know for sure if that's what makes me motion sick or not. So maybe we'll do a ride-along and do some videos for Preach It Girl and see what it's like.
Oh yeah, that'd be fun.
Yeah, that'd be super cool. How can we support you aside from cheering you on and praying for you from the sidelines for your DNP program and your safety in the sky? How else can we follow you and see all your cool pics and know what's going on with you?
You're welcome to follow me on Instagram. My husband and I have a like side IV business, and you can follow that Instagram. And then I actually have a TikTok that I post a lot of like flight medical stuff on. It's less personal, more like fun work stuff. So you can follow me on there, or you know, just watch along in the shadows, whatever you want to do.
Perfect. Your TikTok is super fun to watch. So that you put some hysterical stuff up there, and just seeing you and your friends like kind of be in the moment is very cool. So if anyone's kind of interested in this at all, follow her TikTok. We'll link it below, and that way people can check you out.
Yeah.
Great. And then last but not least, if you could give the world one piece of advice, nurses and non-nurses included, what would it be?
I would say probably like two things. One, I had mentioned, just be kind, like be nice to yourself, be nice to the people around you, be the best version of yourself you can be, you know, and especially be kind to yourself, because you know that negative self-talk turns into like actions, and then actions become habits, and that's like the root of you know, negativity in your life. So be kind to yourself, be kind to others, and then you know, if you want something, you know, career or personal or whatever, you know, don't stop until you get it. Hard work pays off. That is like the biggest takeaway from my life. Everyone's always like, oh, you're so lucky. I hear that a lot. You're so lucky. Everything I did, like, sure, I had maybe a little bit of luck here and there, but like everything that I have achieved has been because I have killed myself to do it, you know? So that's a big thing. You know, if it's worth doing, it's not going to be easy. So work hard and be kind. Those are my takeaways. Work hard, be kind.
I love it. And I think that's probably why people think that you've had so many breaks or maybe had it easy, because you are always so happy and so positive, and it seems like you have no struggles. Life must be really easy for you. But watching you become a new grad and get into the ICU, I know there were moments where you were just overly frustrated and still very positive and still had a smile on and would still walk into that patient room like, hey, buddy. So,
yes, it has not been without struggle.
Oh, I bet. Well, I'll just say a little funny story that I remember about. It's not funny, it's kind of sad, but like, I remember we had a patient that was in our ICU for like 3 months, like a very sick, chronic, repeated like patient. And you were in giving mouth care, and you pulled out like this tissue phlegm thing that was like coated in the back of his throat, and like he breathed better, his oxygen was better, but it had been in there for so long.
It was like a retainer at the
Yes, it was. Exactly. And I remember going, she's such a good nurse. Like, how many people had missed that, or how many people hadn't gone that like far in? So
I think I remember being like,
yeah. It was a funny story, but also like just shows how much of a caring, wonderful human you are. And I'm so glad that the world has you. And thank you so much for interviewing here with Preach It Girl. I hope that everything goes perfect for you. I'd love to get you and your husband on and talk more about what he's doing as a firefighter in your IV clinic. So stay tuned. We'll get some more videos up. And don't forget to follow Vic on TikTok. Your life will be better because of it.
Thank you. Yeah, well, hopefully we'll all get together soon. So.
Yes, absolutely. All right, guys. Well, this is it for today's Preach It Girl. And Vic, you take care and good luck in school. We'll talk to you soon.
Bye.
Bye.